years old, I helped my dad after he was diagnosed with scleroderma. Scleroderma is very important to me because for a year and a half, I watched my dad struggle to fight this disease. Scleroderma is a rare autoimmune disease that many people don't know about. Today, I will tell you first what scleroderma is, second, how you treat scleroderma, and third, how important it is to have a good support system. Scleroderma is very important to me, so it is my goal to educate others. Scleroderma is a very rare autoimmune disease. There are two types, localized and systemic. Localized can be broken down into morphea and linear scleroderma. Localized is where the skin changes in a few spots, but it rarely spreads to other spots of the skin, and the internal organs are not affected, and there is nothing that shows up in the blood work. All the blood is normal. Morphea, which is a subtype of localized scleroderma, is the waxy patches that are found on the skin. These patches can be varying colors, shapes, and sizes, and they can shrink, get bigger, or just go away. Linear scleroderma is localized, and it normally starts as just a line of hardened skin on the arm or the leg. This can go deeper in the skin and can also affect the motion. Systemic scleroderma can be broken down into limited scleroderma and diffuse scleroderma. Systemic affects the connective tissues in many different parts of the body. It can affect the skin, esophagus, intestinal tract, lungs, kidneys, and the heart. It affects the tissues of the skin and the internal organs. These both become hard and do not function in the proper way. Diffuse scleroderma is where the skin thickening occurs faster and affects more skin areas and organs. This is likely to be affected, or the internal organs are likely to be affected in this kind, and those can vary between the heart, lungs, kidney, liver, and the intestinal tract. This is the kind that my dad had. Limited scleroderma is the most common. This is where the skin thickening stays only in the fingers, hands, and face. Internal organ problems are not as common, and if they do happen, they are very less severe. The most common problem with limited scleroderma is pulmonary hypertension. This is when the blood vessels in the lungs are narrow and makes the patient short of breath. All of this information is from the Scleroderma Foundation and my own personal knowledge from learning about it with my dad. Now that we have covered what scleroderma is, this is how you treat it. While there is no cure, scleroderma can be treated and managed in different ways. Everything is trial and error. You can take some medicine to try to slow down the scleroderma and to manage the symptoms. Corticosteroids or anti-inflammatory medication can help provide pain relief from the skin tightening. Special lotions can help with the itchiness caused by the skin hardening. There are medications that can try and slow the skin thickening and organ damage by suppressing the immune system. Blood pressure and the blood flow can be controlled by different medications. There are heartburn medications because heartburn is a common problem with scleroderma patients. And there are also medications to help treat the Raynaud's phenomenon. This happens in many scleroderma patients, and it is when the blood flow to the fingers, toes, ears, and nose is decreased, and it causes these to become white or blue in color, swollen, and sore. It can also cause gangrene if not treated, so this is important to be treated by medication. Each case of scleroderma is unique, so there are very few doctors patients can see or medications they can try to help treat the scleroderma symptoms. Another treatment many try is therapy. Patients go through physical therapy to try and keep the muscles and skin loose and able to move, and also occupational therapy to help them adapt to the different ways that their life is changing so they can still do everyday things. There's also counseling that patients go to because this disease can be hard, because losing mobility and having a chronic disease can be very hard to deal with. This information came from the Hopkins Medicine System. Now that we've talked about treatment, let's talk about the support system. Having a support system is hugely important when someone is diagnosed with scleroderma. Being there is important because there are many physical changes and also mental changes, and a person might need help with everyday tasks or just someone to talk to. Scleroderma can have huge impacts on a patient's health because they have such a lifestyle change and they struggle to be independent. Things that they used to be able to do, they can no longer do, or they have to do in a different way. It can be mentally hard because there is no cure. This is chronic, and scleroderma can change over time, and many people have a hard time dealing with that. Your support system can be friends or family, but also healthcare professionals such as doctors, nurses, and therapists. Doctors can help find the right medication regimen and order different tests. Nurses give medicines and help with activities of daily living, or ADLs, if you are not able to do them on your own, like dressing or bathing. Therapists can be physical and occupational to help with movement or ADLs, or mental health therapists to help a patient understand and cope with their new life. To sum everything up, scleroderma is a rare autoimmune disease that cannot be cured, only treated by different medications. It is important to have a good support system when you have scleroderma. First, I discussed what scleroderma is, then how to treat it, and finally, we learned why it is so important for a scleroderma patient to have a good support system. Many people do not know about scleroderma because it is a rare autoimmune disease. Losing my dad at such a young age has been very hard. Scleroderma took him from me, and it is my goal to educate as many people as I can about what this disease is. Thank you.